Hello there, I'm Blackbright, broadcasting out of the UK. Welcome to my channel. And what am I going to talk about today? Well, there's been a lot in the media. Well, everywhere you look, it's talking about how BAMEs, which is Black and Minority Ethnics, are dying disproportionately with the coronavirus. So I just wanted to elaborate on it and give a few little different perspectives so that we can try and understand whether or not this is the case, or whether or not just that this is the case, because they probably are dying disproportionately, but they're not dying more than whites. I think that is what I wanted to clarify. Because when you look at it in the media and they keep showing you BMAEs are dying disproportionately and they have all these faces of all black people on the television screen and in the newspaper, it implies that black people, not black people, but black people and ethnic minorities are dying more than white people, when it's not the case. It's just a very, very small percentage. But what they're saying is that because blacks and ethnic minorities are such a small percentage in the UK population, it is out of proportion to that number. Anyway, let's first clarify what BAME stands for those of you who don't know. It stands for Black, Minority and Ethnic. And who's included under that title? That's another important thing, because when they say BAME and they use it interchangeably with ethnic minorities, it makes it sound like they're black people. That is the way it's pushed over by the media. BAME, and you see all these black faces, you just think, oh, they're black people. Okay? So the black and minority ethnic it includes mixed race. Some people don't know that, but depending on what statistics they want to use, sometimes if you see they're using 19% of the population is black and ethnic minority, they're including the mixed race in there. But if they're talking about, say, 14%, they probably are not using mixed race, or they probably have some other included in there, or excluded, whichever way it goes. So we have included in the minority ethnics, we have mixed race, we have Indians, we have Pakistanis, we have Bangladeshis, we have Chinese, we have Filipinos, we have Arabs, and we have those from other Asian backgrounds. And of course we have blacks in there, because it's black and ethnic minorities. I don't know why they just don't call everybody minority ethnics, why they have to distinguish blacks from minority ethnics, but who knows. So all these ethnicities constitute between 14% and 19.5%, depending on whether, let me just click that out, depending on whether other is included. So when thinking about the media hyping up BAME are disproportionately dying, we have to look at how this is portrayed. The word black and ethnic minorities, as I've said before, are used interchangeably as though it's the same thing or applies to the same people. Have you also noticed that the number of times that words like 4.2 more likely, 3 times more likely, that's how they use it. You know, when they're talking about the BAMEs are dying disproportionately, they'll say, oh, 4.2 times more likely to die more than whites, 3 times more likely to die more than whites, 5 times more likely to die more than whites. So do they give you any figures? Why do you think that is? Because if they gave figures, then it would not look as, it wouldn't be so interesting. It wouldn't kind of build up the picture that they want to build. So they don't give you any figures. They just talk about this 4 times or 3 times or whatever. And when you're talking about statistics, you can play it big time. So if you say 4 times more and only 1 person dies, that means 4 people die. But they would make it look as though it is all way out of proportion. So, what else have I got here? Every death needs to be mourned and respected, of course. Condolences go out to the families of those who have died. So this isn't about minimizing who's died or who's not. This isn't about a competition about how many blacks have died versus how many Asians or how many Filipinos or how many whites. It's to do with how the media is portraying the deaths. That is what I'm trying to clarify. Just wanted to put that on the tables up front. Okay, so we've got 223,060 confirmed cases of the coronavirus, 3,877 new cases. I'm not quite sure of the date of this, and the 32,065 UK deaths. The only reason I'm talking about this is because what I would like to see out of the 32,065 deaths is how many blacks died as opposed to the other minority ethnics, so we can get a clearer picture of who is dying from who isn't and what ethnicity. But that breakdown doesn't seem to be available. Other interesting finding, according to the health sector journal, only one West Indian died, as opposed to several Africans, several Filipinos in the health sector, and several Indians. I'm going to give you the statistics of those, but I just thought it's interesting how it's when it's broken down, how it loses a bit of the oomph. You know what I mean? That picture that they're trying to portray, that, you know, blacks and minority ethnics are more contagious, because, be honest, that is the image they're trying to portray, that blacks and minority ethnics are more contagious. When they're sending out that picture, or all those faces that they're putting in the media and on the TV screens, that's what they're trying to say. So figures of black and minority ethnics are being cited when they refer to infected persons, but vague references when it comes to deaths. Yeah, I could find figures when it came to infected persons, but when it came to deaths, no breakdown. Isn't that unusual? For example, in the Telegraph, it states 13,918 patients in hospital who tested positive for the coronavirus as at the 17th of April. 16.2% were from black and minority ethnic backgrounds. What does that translate in from 13,918 patients? 16.2% were minority ethnics. 2,255. 2,255 were from black and minority ethnics when you consider how wide and broad the ethnicities that are included in that. And that means that over 11,000 were white. It paints a different picture, doesn't it? Like I said, I'm not trying to make out like some, anything is better than one is better than the other, or, one is, I don't know, more credible than the other. I'm just working from the statistics and the picture that they paint and what is the reality. So white people are dying more than blacks and minority ethnics, but you wouldn't think that when you see the picture painted by the media. The media also shows black and Asian faces to feed their narrative. How come we don't see the 11,691 white faces on our TV screen who died? Why aren't we, mourning for those? Why aren't we grieving for those people? Why aren't we seeing them? Why aren't they being recognised? Because they're not. When you see those black faces on the screen, it's almost like they're the only people who are dying, when there's thousands of white people dying. So why don't we get to see them? Why don't we get to see their faces? You see one dabbed here, one dabbed there, one odd one here, one odd one there. Why is that? I'm sure they're, well, not unless their families have said that they don't want their faces publicised. That could be a reason. But even then, you know, even if they don't want to show the faces, they could say the numbers. So by using the word disproportionate, it could look like black people and ethnic minorities are dying from the coronavirus more than whites, when this isn't the case. Apparently, those identified as Indian make up the single worst affected group at 3%, and then with Caribbeans at 2.9%. And that's in the health sector. That's not overall. Out of 119 health NHS staff who died, 53 of 64, i.e. 83%, were born outside the UK, according to the Health Service Journal. Caucasian deaths of those born outside the UK was 53%. There was one from the Caribbean, as I mentioned earlier. Health workers, however, are allegedly not dying any more than those in any other occupation. So just because we hear about health workers dying, it's not any higher than anybody working in any other sector. That's basically what they're saying. But again, we get the feeling when we're listening to the news that because you're a health worker, because you're working in a hospital, that means you've got more chances of dying than anybody else. And according to the Health Sector Journal, that isn't the case. I'm going to put their link down below so you can get a good picture. It's very, very interesting reading, to be honest. What else have I got here? So from this, would you agree that BAMEs should be highlighted in a way that gives the impression that they are more contagious than anyone else? That is my question to you. Okay, so none of us have any control over bias reporting, fabrication, misrepresentation, disinformation, or misinformation. Only the government does. So we have to use the information we are given, which is a way to public figures, which is why public figures are calling for which is why 70 public figures are calling for a full independent public inquiry into the deaths of black and ethnic minorities from the coronavirus. So we've got 70 public officials who have written a letter to the Prime Minister asking for a public inquiry into the deaths. And that is because of the way it's portrayed. I'm not saying that they shouldn't. Of course, that's not what I'm saying. I'm just saying that, you know, it's just feeding the narrative once again. The emergency laws could make it very difficult for them to access that information anyway. I don't even think that they're allowed to have an inquest under the emergency laws. I don't know if the emergency laws are in force yet, if they're not in force yet, because as I said yesterday, they can be stepped up or they can be stepped down, or they can be, or should I say, turned on and turned off, depending. So maybe if it's got to the point where they've written a letter to Boris Johnson regarding a public inquiry, maybe that aspect of it hasn't been switched on yet. So BME have died disproportionately given their low percentage of 14% of UK population during the pandemic. I'm not saying they died with the coronavirus or of the coronavirus, because since recording has been relaxed, nobody knows who died of what. The Venetian interpretation of the Coronavirus Act 2020. I mean, I've spoken about the Coronavirus Act before, and it is kind of scary. But the Venetian, that's B for Bertie, E for Echo, R for Romeo, N for November, I for India, C for... I don't know what C is for. I for India, A for Apple, N for November. The Venetian... they've quoted, well, I don't know if they've quoted, but according to them, this is what we can expect of, or these are the provisions in the Coronavirus Act when it really gets serious. No inquest into any suspicious deaths, will be held until further notice. When I say before the shit hits the fan, it's when they get switched on. At the moment, they may not be switched on, but at any point, these provisions can be switched on in the Coronavirus Act. Okay, no inquest into any suspicious deaths will be held until further notice. Authorities can take biological samples of your body, apparently by force. Your body can be claimed as property of the state to do with it what they see fit. No requirements for medical certification for burials and cremations. The health service is indemnified should they fail to provide proper care to people who need it, or if they administer forced treatment and the patient dies as a result. I think he's translated this in his own words, because I remember seeing something similar, but it wasn't these exact words. So I think this is his translation of the Coronavirus Act. Only one appointed medical officer is required to sign off compulsory treatment orders, in brackets forced medication, he's called it. A cross-section of the aforementioned provisions, if in place and carried out, could be a contributory factor to BAMEs dying who have underlying symptoms as they don't receive proper care, if they don't receive proper care. So what I was trying to say is, if any of these are switched on, like supposing the one that says, where's the one that says, the health service is indemnified should they fail to provide proper care to people who need it, or if they, that part there. Now, if that is switched on, that could mean that black and minority ethnics who go into hospital, not the ones who are actually administering the care, but as a patient, that could mean that if they have underlying symptoms and it's deemed that it's not necessary to put them on a ventilator, that might not be considered proper care. It would be considered proper care if they did put them on a ventilator and gave them a chance to live. That could be another reason why, if it is switched on, black and minority ethnics could be dying disproportionately. But we don't know what's switched on and what's switched off at the moment. What else? The coronavirus appears to have a built-in bias. Who birthed it? We are told racism is taught and children are not born racist. Can a virus be trained to be racist? Like the algorithms in the Home Office systems were taught to flag undesirables. No, because the fact of the matter is more white people are dying than black people. And just because it's disproportionate doesn't mean it should be blown out of proportion or minimised. What it does mean is that we do need to keep things into perspective and try not to get paranoid, because paranoia disadvantages us negatively and negatively impacts our judgment. We are told that COVID-19 has a devastating effect on black and minority ethnics. However, according to the Intensive Care National Audit and Research Centre, who focus on people who are likely to become, currently are, or are recovering from being critically ill from the coronavirus. Out of 1,966 patients with COVID-19, 65% were white, 14% were black, 14% were Asian, 6% were other. So, what do those figures tell you? So, to be honest, it doesn't really, it's sad that anybody is dying. And this isn't about, like I said, it might sound like, oh yeah, white people are dying more than black people. I mean, that is a fact. But it's more to do with, representing the statistics in an open and transparent way, and not to make it look like that that black and minority ethnics are, dying more than anyone else. And like somebody said, is it an excuse if they say black people and minority ethnics are dying or more prone to the virus, does it mean that they get tested or given the vaccine first? We have to think about the motives behind the information we're receiving and just making sure that it's reported correctly. Like I said, I can only take what I'm given. I haven't got, I can't see no credible information. I don't have access to any documentation. The Health Service Journal, very credible source. That's where I got most of that information from. Got some from the Telegraph, another credible source. And so, yeah, these figures are not, this information is not just taken out of a hat. It's, I just give my opinion on the information I receive or I've read. So I hope you found that useful. And that's all for now. Bye-bye.